morning, good afternoon, good evening, wherever you may happen to be. We are so glad you're able to join us here for this webinar in the Quitting and Identity series put on by the Truth Initiative and the X program. I'm Todd Nielsen. I am one of the community management team in the X community. If you haven't heard of the X community, stay tuned. We'll give you a link to be sure that you can join it at the conclusion of this webinar. If you are from the community, glad you're here, glad you're able to join us. The X community is a free service, part of the X program, for anyone that is trying to quit smoking, vaping, using any kind of tobacco-related products. And today I am very excited to be welcoming our two guests from CAI, Jennifer Lee and David Davis. We're going to bring them up here in just a moment. They're waiting in the wings here to come on screen. But just to give you a little bit of background about today's webinar, our guests are from Chickatelli Associates Incorporated, CAI. This is a diverse, mission-driven nonprofit organization incorporated in 1979. They work nationally and internationally, and their mission is to use the transformative power of education and research to foster a more aware, healthy, compassionate, and equitable world. They do this by providing innovative and high-quality training, technical assistance, curriculum development, research, and other capacity-building support to make policy, systems, and people change to address enduring disparities in health and life outcomes, particularly for communities that have been marginalized. So this includes over 3 decades of experience addressing tobacco control policy, systems, and social norms change. CAI is at the leading edge of innovation as the newly SAM-HSA funded National Center of Excellence for Tobacco-Free Recovery that provides training, support, and technical assistance to state departments of health, healthcare organizations, behavioral health practitioners, and people with lived experience and their families to reduce the rates of tobacco use for individuals dealing with BH and substance use challenges. As a grantee of the NYSDOH Bureau of Tobacco Control, CAI has been making policy and systems change that resulted in dramatic declines in the use of commercial tobacco products by youth and adults. And they are working deeply with communities in Mississippi to design and implement a community-led and engaged response to tobacco use. I'm coming at you here today from northeastern Wisconsin, indigenous lands of the Ho-Chunk and Menominee peoples. Very glad that you are here with us today. I am very pleased to be introducing David Davis, the LMSW Director of Tobacco Control Health Initiatives, and Jennifer Lee, PhD and MPH, Senior Public Health Director from CAI. Welcome to both of you. How are you both today?
Thank you so much for the introduction, Todd. We're doing well, and we're excited really to engage in this discussion today. Wanted to note before we begin that as we want to highlight that all references to tobacco and tobacco products within this presentation refer to commercial tobacco and nicotine products and not the tobacco and or other plant mixtures grown or harvested and used by indigenous people for sacred purposes. So we just wanted to begin by providing that statement to folks. And I'll also give an opportunity for my colleague, Dr. Jennifer Lee, to introduce herself a little bit. Say hello.
David. Hi, Todd. Hi, everyone. As David mentioned, we're so thrilled to be here with you all today and look forward to a really interacting, healing, and loving session with you all. So buckle up and we'll get going.
Great. Thank you so much, Jennifer. And today we wanted to recognize that discussing trauma can be triggering for many individuals, right? It's important for you to prioritize your self-care during these conversations. So I really want to let you all know to please take breaks as needed if you find yourself feeling overwhelmed, right? Your well-being is our top priority. All right, so today, in that spirit, to begin, I'd like to lead you all in a grounding exercise. Now, grounding is a set of techniques that help people bring themselves back to the present moment and regain a sense of control and safety. Grounding can be used to intervene at times when we're particularly emotionally heightened, but it also can be used to prevent those instances from happening as often. The grounding exercise that we'll be engaging in today is called diaphragmatic deep breathing or deep belly breathing. It is a simple yet powerful exercise that will help us center our thoughts, calm our minds, and connect to our bodies. All right, so let's just begin. And I want everyone to just join in and participate if you can. All right, first, we want you to find a comfortable position and place your back firmly against the back of your chair and plant your feet flat on the ground. If you're feeling comfortable, you can close your eyes or lower your gaze, or you can leave your eyes open if you like. Next, we'll ask that you place your hand on your belly, and just notice the breath that you're breathing. Take a moment to notice how your body feels. Are there any areas of tension? Any places where you feel relaxed? Just observe without judgment, right? Notice your back against your chair and your feet that's planted on the ground. Now let's focus on your breath. Begin by bringing your attention to your natural breathing pattern. Notice the rise and fall of your chest and belly as you breathe in and out. There's no need to change your breathing just yet. Just simply notice it. All right. Now let's start deep belly breathing. When we breathe deeply, we want to allow our whole belly to expand fully. So I'd like you to inhale deeply through your nose for a count of 4. All right? Then feel your belly rise as you fill your lungs with air. Hold your breath for a moment, just for a count of 2. Now exhale slowly through your mouth for a count of 6. Feeling your belly fall as you release the air. So let's do this 3 times, all right? We're going to inhale deeply through the nose, right? Like you're smelling flowers, right? 1, 2, 3, 4. Then you're going to hold for about 2 seconds. 1, 2. Then exhale slowly through your mouth like you're blowing out a candle. 2, 3, 4, 5, 6. Let's do that again. Inhale deeply for a count of 4. 2, 3, 4. Hold for about 2 seconds. 1, 2. And exhale slowly for a count of 6. 2, 3, 4, 5, 6. And one more time. Inhale deeply. 1, 2, 3, 4. Now you hold for about 2 seconds. 1, 2. And then you exhale slowly. 2, 3, 4, 5, 6. Great. Now let your breathing return to its natural rhythm. And when you're ready, gently bring your awareness back to the room. Wiggle your fingers and toes. And if your eyes were closed, slowly open them. Take a moment to notice how you feel compared to when we started. Right? And we're hoping that you're feeling a sense of more calmness or clarity, and you may feel more connected to your body and present in this moment. So I want to thank you for participating in this grounding exercise. And remember that you can return to this practice anytime you need to find ways to calm yourself and center yourself. All right. So now, thank you so much for participating. We're going to turn the floor over back to Todd to kick us off with a poll question.
Hey, thank you so much, David. That was very relaxing to go through that. I very much appreciate that. As you said, we have a poll because we were hoping to learn a little bit more about how that you experienced. Oops, sorry, this is the wrong poll. Here we go. Here we go. The grounding exercise. Here's the correct one. I don't do these very often. So the question is, what other activities or things do you do to ground yourself? Maybe it's meditation. Maybe it's taking a walk on the beach. What kinds of things do you do to calm yourself, to ground yourself in the moment?
Interestingly enough, Todd, one of the things that I do to calm myself is I watch random court clips on YouTube. I don't know why, but it seems to just be very calming for me. I don't know what that says about me, but it's very calming for me to watch those random court clips on YouTube. Just the court proceedings, just alone, just seem calming to me. I don't know why.
I love it. I love it. Well, sometimes for me, it's watching old clips of Saturday morning cartoon shows from when I was a kid. That's
Mhm.
very grounding.
Absolutely.
I'm all about the puppy videos. They're just so cute. Make me smile. Puppies and babies, I think, are just so adorable.
That's wonderful. All right, we've got about half of the participants here have gone. We'll just give it another 15, 20 seconds if you have a chance. Any final takers? How do you ground yourself? What kind of things do you do? Maybe it's going and getting a drink of water and really enjoying it. All right, we'll just wrap things up here. Okay, I'm going to end the poll. We had some responses that came through here. Just going to share the results. Yeah, we have some great responses here. I play tennis. I put the music on and clean my house. Hiking, music, tend to a koi pond. Oh, well, that sounds very relaxing,
Oh yeah,
actually.
the koi pond. Yeah.
Listening to music is very popular.
Mhm.
Concentrate on my surroundings. Get into nature daily. Go for a walk. Journal.
Mhm.
Talking to family or friends.
Yeah.
It's wonderful. Yeah. Well, thanks for taking a moment to share with that. I think let's dive into our conversation here a little bit further. I guess first question for Jennifer: how is it that you define trauma? How do you think about it? How does CAI think about it?
Yeah, thanks, Todd. And thank you, everyone, for indulging in that chat. And I think related to trauma, it's really important to understand ways that you can take care of yourself. And I think the playing tennis, nature, walking, these are all really important concepts and things that we're going to continue to highlight throughout today. So I think that's just important to acknowledge and appreciate people sharing. Um, but yeah, trauma is really a response to a deeply distressing or disturbing event that really overwhelms a person's ability to cope. And it can really cause feelings around helplessness, diminishing, sense of self, and their ability to feel like a full range of experiences and emotions. And trauma can really be physical injuries from, let's say, an accident, emotional, so loss of loved ones, or psychological, so experience of abuse or neglect. And then, these symptoms really manifest in various ways, including flashbacks, nightmares, severe anxiety, and uncontrollable thoughts about the event. And so, triggers related to trauma, and David already mentioned, take care of yourself during the session, but, you know, these triggers can really evoke memories or feelings associated with that past traumatic event. And recognizing and understanding your triggers are really important in how to manage them. And I think some of the breathing exercises and the walking and the tennis and all those pieces are ways that you all already have lots of great coping mechanisms and opportunities to take care of yourself if you were to be triggered. Um, some of the long-term effects, if you don't, address it right away, it can really lead to PTSD or post-traumatic stress disorder, depression, and other anxiety disorders. But what's most important that David and I really talk about a lot is healing and recovery from trauma. And that can involve therapy, support from loved ones. One of you mentioned talking to family and friends, and also medication at times as well. And, these techniques, the mindfulness, the grounding exercises like the one we just did, and therapy can be really effective combined. And as we're doing, this webinar today, I think it's important to also recognize being trauma informed or providing trauma informed care is really key because those who support you, your family, your friends, loved ones, your social networks, your community, and your medical providers really have to understand the impact of trauma on behavior and providing support that really acknowledges and addresses these lived experiences that, we all hold to a certain degree.
Thank you so much, Jennifer. I will say that one of the things that's always been moving to me about being involved with the X program through the Truth Initiative has been that community space that we built allows for people to join anonymously. And we've heard over the years from individuals who joined that place, it's become a more safe environment for them to share things about their quit with other people who are going through or have gone through similar sorts of issues. And in many cases, sharing sometimes quite personal traumas, even anonymously, through that in ways that maybe they couldn't talk to their families about.
Yeah, that's so critical, Todd. And I'm so glad that the X program has a space or a safer space where people can share and meaningfully connect. And we'll continue to, make this thread as we continue to talk through today. But that's critical. Whether it's anonymous or you might have trusted folks, being able to talk to anybody in your environment is so key in healing and recovery and being able to own that and also recognize your journey as well.
Yeah, no, thank you. I guess this leads me to a question for David about what is that link between trauma and nicotine or vaping addiction? Where do these things interrelate, and how do you think about them?
Yeah, thank you for the question, Todd. Right, that link between trauma and nicotine or vaping addiction is significant and multifaceted, right? Many individuals who experience trauma may turn to substances like nicotine or vaping, right, as a way to cope with their emotional pain. So as Jennifer noted, right, trauma can lead to that heightened emotional distress, anxiety, and feelings of being overwhelmed. And nicotine from smoking or vaping stimulates that release of dopamine, which is that neurotransmitter associated with pleasure and reward, providing a temporary sense of relief or calm, which just makes smoking or vaping appealing as a coping mechanism and serves as a temporary distraction from those intrusive thoughts or flashbacks related to trauma, right? So really just providing that momentary escape, right? But really why that's problematic is while the nicotine that one gets from smoking or vaping may provide that short-term relief, it often leads to that addiction, right? Creating a vicious cycle where the individual feels compelled to use it more frequently, which can exacerbate anxiety and stress over time. And what I really want people to note here is that many people don't realize that the withdrawal symptoms from smoking or vaping can mimic or exacerbate mental health issues, right? So this creates a vicious cycle where individuals believe smoking or vaping is helping them cope, when in fact it's actually the contributing factor, a significant contributing factor to their discomfort. And additionally, both smoking and vaping carry that significant health risk, right? Including respiratory issues, cancer, diabetes, and cardiovascular disease, right? These risks can further compound trauma-related stress, creating that, once again, that vicious cycle of health concerns, right? Relying on nicotine as a coping mechanism can also prevent individuals from addressing that underlying trauma, right? That avoidance can hinder the healing process that Jennifer was referring to and lead to those long-term emotional and psychological issues. So really, it's in breaking that link, right, between trauma and nicotine vaping addiction, it just really requires a lot of support, some education, helping folks really understand the true nature of their symptoms and finding healthier coping mechanisms, right? So,
It almost sounds like the smoking or vaping, something that can seem like a friend, but is really this deceptive thing that is not there to help you at all. It's going to, and as anyone who's gone through that process of trying to quit, has felt, it might make you feel good for a few minutes, but then you feel the other side of that really quickly.
Absolutely. Yeah, we have to be very careful, right? And big tobacco has done a good job of making smoking seem as if it's something that's supposed to help you relax and feel good and feel better about things. And it's really, right, that predator, right? That thing that's hanging out there that's really there to grab you and take over. Because that once that addiction starts, it's just so difficult. And so really have to be just aware of how that relationship between trauma and smoking or vaping.
So, what can people who've maybe lived through trauma do to make quitting easier and find some new ways to cope with the traumatic aftershocks without having recourse to tobacco-related products?
Yeah, thanks, Todd. And I just will say out loud and transparently and open, I am someone who definitely has been on a quit journey for many years, on and off, with anxiety and depression and managing that and really figuring out these ways. So some of these strategies to consider are things that I'm constantly thinking about and working on my journey, as well. And so I hope they'll land, in a way that I've tried them. I know how hard it can be, but I think the most important thing that in our work, David and I really consider is really about, self-awareness and self-compassion are really key as part of your journey. So give yourself love and grace, right? That kind of self-compassion is really vital in the journey as you're healing, not only from your trauma, but also addiction, right, to tobacco use as well. Many of you talked about speaking to friends, but you got to speak to yourself the same way you would speak to a friend or a loved one when you're giving them advice as well. And just acknowledge like this is a struggle. Quitting is very hard. The journey is difficult. There's good days, bad days, and it's really about not being so critical on yourself, but acknowledging that you're making progress, even no matter how small, is really can be like a thing to celebrate as part of your success in your journey. Supportive language is always good too, especially during the tough moments. You can self-affirmations and that self-empowerment is also really important. And I think one of the things like the reality check also is about accepting and acknowledging that lapses and struggles on the quit journey are real and part of every human experience. And you're definitely not alone, and many people face similar challenges in this journey as well. And the last thing I'll say before I kind of ask David to talk a little bit more about some other strategies are, I've definitely have a nice support system, including doctors and, mental health providers or behavioral health practitioners who support me in my journey as well. And they can really help you understand, and support you in developing a treatment plan that also addresses both nicotine addiction and your trauma. And so that kind of therapy for me has worked really well. And that kind of support, not only therapy, but there's support groups, medication, and all other types of strategies that we also talk about. But that could be one step in your journey as well for that extra reinforcement from trusted medical providers that can also provide you with real support. But David, I think you can talk more about some of the nicotine replacement therapy and maybe expanding on some of the grounding techniques with medication that might work well for folks too.
Yeah, thank you so much, Jennifer. And as you noted, right, starting that discussion with your provider or behavioral health practitioner, your mental health provider is really key, right? As they kind of figure out how am I going to address both your trauma that you might be experiencing and your nicotine addiction and vaping addiction, right? So just want to begin by noting that, there are 7 FDA approved medications for treating nicotine or vaping addiction, right? We have 5 nicotine replacement therapies, or like what we like to call NRT, which include nicotine gum, lozenge, inhaler, and spray, as well as 2 medications, right? Varenicline and bupropion. The nicotine gum, lozenge, and patch are available over the counter. And to obtain the nicotine inhaler or spray or the 2 tobacco use treatment medications that we mentioned, right, varenicline and bupropion, you will need a prescription from your medical or behavioral health provider in order to obtain that. Now, please, I just want to also note that the nicotine inhaler, unfortunately, is not currently available for sale in the US due to a shortage of a product needed to make that mouthpiece. So currently, that's not on the market, but we're hoping that it'll come back on the market, hopefully pretty soon. All right. And now, just to get the most optimal effect from NRT, we really highly recommend to use combination NRT, right? That combination NRT is when a person uses a long-acting NRT, like the nicotine patch, that provides a steady, controlled release of nicotine throughout the day, and a short-acting NRT, like the nicotine gum, lozenge, inhaler, or spray, that gives you nicotine more quickly to help you get through cravings or even in anticipation of a craving. I also want to note that it's really extremely important that people use NRT correctly. The common mistakes that occur when people are using NRT that they don't know how to properly use those different forms of NRT. So, for example, how to chew the NRT gum, right? Chewing NRT gum is not like chewing a piece of Bazooka Joe. I think I might be aging myself here, right? Or Trident, right? Or Wrigley's. When using NRT gum, you have to use a chew and park method, right? When you chew the NRT, you park it between your cheeks and your gum. So you really have to understand really how to properly use the NRT to get the best effect. And additionally, we often find that people are using too much of a low dose of NRT, like they don't use enough NRT in terms of the dosage that's attributed with that, discontinuing use of it too early, or not using it consistently enough when attempting to quit smoking or vaping, which significantly reduces its effectiveness in helping you on your quit journey. Now, earlier I noted that many people don't realize that the withdrawal symptoms from smoking or vaping can mimic or exacerbate trauma responses. And we spoke a little bit about this vicious cycle where individuals believe smoking or vaping is helping them cope, when in fact, it's contributing to their discomfort, right? So you may not know if you're experiencing withdrawal symptoms that are mimicking the trauma response, or the trauma response that might be triggering, it might be the trauma response that's triggering you to want to smoke or vape. So it's really important to address both at the same time to get better outcomes. So how do you do that, right? First, we talked about reaching out to your medical provider, your behavioral practitioner, to really start to develop a treatment plan. All right. And you can engage in therapy that can support you in addressing trauma and smoking or vaping, such as cognitive behavioral therapy or CBT, and use NRT or tobacco use treatment medications such as varenicline and bupropion. And when faced with trauma triggers or emotional distress, you can combine those grounding techniques, right? We just did a deep belly breathing exercise earlier, right? And then you pair that with nicotine replacement therapy to support your quit journey and your trauma recovery. Also, keeping track of situations that trigger both your nicotine craving and trauma responses, right? Identifying those can help you develop strategies to cope without resorting to smoking or vaping. All right, so Jennifer, I could pass it over to you to discuss how to lean on your support system and other things you can do to reduce your and address your tobacco use.
Yeah, thank you so much, David. Um, we've talked about your support network a lot and connecting with them. And, Todd, you mentioned the X program as an anonymous way for people to connect. And you may just have people in your immediate community, social networks, family, loved ones that you can lean on. And we just want to reiterate and highlight, sharing your lived experiences and your story really can provide emotional support. And people can share really practical tips and opportunities for you to kind of relate on managing trauma and tobacco use as well. Something else related to seeking support is just surrounding yourself with love and supportive people, right? To start that really understand your journey. And, those experiences that you share also just reinforce feelings of connection and compassion, which are really critical. Not just to be able to talk and share your story, but also to have loving and supportive people around you who can hold you and listen and, be with you on your journey as you continue to set forth a path. And I think some of the things that you can consider also are setting realistic goals, right? And breaking the journey into really manageable steps. I think I mentioned already, it's celebrating those small victories and being gentle with yourself when things don't go as planned. Those positive affirmations in your daily routine are really good. I know someone mentioned journaling. I think the first way I start my journaling is with a positive affirmation to remind myself, of my, our strength, our ability to overcome challenges. Todd, do you want to jump in real quick
Yeah, I was
before?
just going to say, Jennifer, one of the things that that I've found has been really great within the X community online is a daily ritual called the Daily Pledge, where people come in and they pledge not to smoke and they extend their hand to the next person in the chat. And it was basically, it's a discussion thread that goes on for the entire month and gets on average maybe about 55 pages of people responding to each other on a daily basis, offering their support of each other. It's quite moving to see everybody there and helping, and especially if someone's having a rough time, they'll jump in either there in that event or on a separate page and talk about what they may be trying to struggle through at the moment, and people respond really quickly within that space. It's such an important thing to have that, whether you have it in your personal life or somebody you can walk across the hall and talk to, or you've got someone online to do that. It's 2 a.m. and you're having a dark night of the soul, and you've got something you can bring to that as well.
Oh, that's beautiful and lovely. And I'm so glad a space like that exists, and people can get like that immediate support from also people who understand truly about the journey as well. And yeah, so I think just to add to that, beyond the social support and the networks and opportunities to share, there's things you can individually do as well around some like harm reduction approaches, which really is about making those small changes in daily habits that reduce your tobacco use and, help you better manage your triggers. We know everybody cares about their lives and has the power and are in control of the choices we make every day. And some small things that, we consider and think about are just smoking and vaping less each day, or figuring out times when maybe you don't smoke or vape, like especially with that morning coffee, maybe you delay it until the lunch hour, right? You might just smoke or vape or use tobacco on the odd hours or the even hours of each day. Put a little bit of a longer time between using, if you did at 12 p.m., maybe you wait till 3 o'clock and see if you can wait a little bit longer. And of course, it's using those really low barrier, low cost, and hopefully readily accessible NRT things like gum and patches and lozenges in between to really crush the cravings and manage the triggers. And I think those have been really great ways that, I've gotten through the journey and have to, continue to consider and think about when I am triggered or having some cravings and having, some rough times and feeling like, oh, I just want a cigarette, so.
I love the framing of that as harm reduction approaches. One of the things I've seen within the community that people have brought up over the years is a list of 100 or 101 things to do instead of smoking or vaping, right? And those things vary quite widely, from breathing, grounding exercises to having a straw, as a distraction rather than having, that tendency to be carrying a cigarette or vaping instrument in your hand. Just the ways to deprogram yourself a little bit from those habits that we find ourselves falling into.
Absolutely, Todd. I think that's great. Another thing I did a lot was drink water, because it's just like this constant needing something and to be refreshed with something that, is natural and, makes me feel good and stay hydrated. So yeah, absolutely. There's so many different ways and things. We probably can't cover them in an exhaustive way today, but I think it's just some things to ignite some thinking and opportunities for us to, as a community, continue to heal and recover and support each other as well.
Wonderful. Thank you for that. Thank you for that. So I know we've had a couple of questions that have come up in the Q&A section, and I've been watching the community for anybody talking about sort of their experiences and coupled difficulties between trauma and use of tobacco or tobacco products. I'm wondering, one of the things that comes up frequently as a topic is, what happens if I relapse? And I'm wondering if you have some suggestions about managing relapse, especially in a trauma-informed way. If either of you, whichever one of you wants to take it, and kind of think about it a little bit.
Yeah, I just want to note that this is really a natural part of of going through the process of the quit journey, right? Relapses happen. We really encourage people to normalize this as part of the process of the quit journey, right? When the X community is sharing a lot of great information with each other over the years, I'm sure that there was a lot of conversations about relapsing and what to do, right? And this is not a time to beat up on yourself. You're not a failure. You have to understand it might take between 6 to sometimes 30 times. That's what the research says, right? And what people have shared with us anecdotally over the years, is that, yeah, it takes so much time sometimes to go through that journey to finally when you're able to end smoking or vaping. And so just be gentle with yourself, right? Really be mindful of what's going on. Think about, do some, I would say sit back and just reflect a little bit about what led to this moment, right? You can always think about what was I going through? Was it something where I felt more stressed, dealing with anxiety? Really try to understand what led up to that relapse is definitely, or that lapse, we like to call it, is very important. And so additionally, making sure that you think about other ways to kind of help you deal with your nicotine withdrawal symptoms, right? So as we noted before, using that patch, using that gum, right, would be helpful too to kind of help you with your next attempt as you're going along your quit journey. But take some time to reflect, right? Get back up on that horse, right? Get back out there and doing it and say, hey, I'm back at it again until we reach the final goal, which is really to end the tobacco and the vaping. And you have a wonderful group of colleagues here in your X community who I know will be able to be there to help support you with that, and make sure that you keep you on track as you continue to push towards your goal. Jennifer, I don't think anything else to add.
No, I love the framing message of that. Jennifer, sorry, yeah, please, anything you wanted to add?
No, David, I think you've said it. And I think throughout today's discussion, we've really centered yourself in this, to be compassionate and kind. And as David mentioned, it is just intrinsically part of the journey and understanding that. And I think recognizing that from the beginning is really important. Because if it were easy, we'd all just be done with it, right? But it's highly addictive, and it definitely, for me, it was definitely a coping mechanism for the stressors or the triggers and all the things. And it was so easy to just revert to that as I need my 5 minutes outside. And this is a thing that just gives me a minute. And David mentioned, like, in that biological way, it made me feel better in the moment, but I think it just further compounded, my inability to really take care of myself and switching it out. I think, Todd, you said kind of reprogramming our minds and the behaviors around that. It took me a long time to figure out what's that happy medium or the sweet spots of how I can do that in a journey, really, because I think there were things that work. Some days it would work, some days it wouldn't. I have to try something else. And so I think that's really important to highlight. And I just, it's a constant struggle to be liberated from this, you know, substance, if you will. And, our mental health just, for me, continues to be layered with all the things that are going on in the world, to my family and, things that I've been through. And sometimes it just feels so heavy, but I do have David at work to talk to about a lot of things. Not only do we work together, but I know he's got my back, and I can be like, listen, I'm having a moment right now. And I really appreciate that. Even in a professional setting, I have that kind of support, because I do spend most of my days with David and our team. And, to be able to be open and honest and to be doing this tobacco-free recovery work with other states and people with lived experience and living with this experience still, I think, we're here to activate everyone to support each other better and be parts of people's journey. Like, whether you utilize tobacco products or not, we all have something to do to create change. And I think that's one of the most important things we want everyone to walk away with. If you work in an organization or you're someone who continues to utilize tobacco products, we all can be supportive to each other, from the health system side of things to your, as a family member, as a friend, as a colleague, and as folks who are, running a national center who want to make compassion, love, grace, and support more readily available for people so that it doesn't feel so isolating or, stigmatized, I guess. So Yeah,
Mhm.
that's all I would add.
Thank you. Thank you for that, Jennifer. That's wonderful. And we've had a couple of questions come in here. Just one I wanted to answer publicly. I did it in the chat previously. They were asking if the session's being recorded and if it's going to be available to be watched later. Yes, absolutely. We are recording this session. It's going to be up on the Truth Initiative's YouTube channel, as well as available for replay within the X community itself. So we'll have it in both of those spots. You will be able to catch it. Ideally, we probably even have it broken up into a couple of shorter reels, so you can get some key moments, some of the wonderful wisdom that David and Jennifer have shared with us today in what they're doing. So thank you for that question, and glad you were able to join us at work, listening with one earbud. That's wonderful. The other questions coming in here, two others. One is, are there communities like the X community for people with trauma? That's an interesting one. I don't know if either of you happen to know of places like that, Jennifer or David.
Yeah, there are some groups I have to say I cannot sit here and recommend one or the other here. I think people have to do some of their research, but I do know there's groups like After Silence. There's other groups like Community Safe Group, CPTSD Community Safe Group, right? So there's some groups that are out there. I mean, and I cannot. I just want to just note so publicly that we don't know the quality of these groups, but that they are available, and we can be sure to list them as part of the resources. At least some suggestions at the end of this webinar.
Of course. Yeah, that's a great. Yeah, we can't specifically endorse any of them that are out
Right,
there. But I would suspect that, as David was suggesting in his answer, there are some very specific sorts of trauma that are being supported
right.
by individual online communities that
Mhm.
are available out there. And of course, if you are in the process of your quit and you happen to have some traumas to one extent or another, we are providing that peer support and space within the X community for you as well.
Yeah. And I'd like to just note too, Todd, I mean, they do have the American Trauma Society. If folks would like to go onto their website and take a look, they do have a lot of different resources related to community forums. So you might want to take a look at their website and see if something seems to fit for you. But we do know that there's some websites and forums that are out there.
Wonderful, wonderful. And I see, Jennifer, you took the last question here. Are people with PTSD more likely to relapse? Yeah, I'd be curious your answer for that.
Yeah, yeah. Yes, the answer is yes. People with PTSD are definitely more likely to use tobacco and experience relapse. And from the research that we've looked at, about 45% of adults with PTSD smoke. So that's almost half of everyone that has PTSD smokes. And they're twice as likely to develop a smoking dependence compared to those without PTSD. And this relationship is really deep because PTSD and smoking is bidirectional. And that means that smoking can exacerbate PTSD symptoms, and then PTSD can increase the likelihood of smoking as well. And this connection is really partly due to the fact that smoking, again, it temporarily reduces that anxiety and the distress, which David had talked about earlier, which are common symptoms of PTSD, but that relief is really short-lived. So when you take that 5-minute break and you feel better, it feels better in that moment. But that cycle of dependence and relapse is really challenging to break because it feels good for a second, but then you're really not addressing the root of what's happening there. And so it's really critical that, for PTSD for sure, engaging healthcare professionals and support will be really important. And of course, giving love, grace, and kindness to yourself or others who may be dealing with PTSD and tobacco use will be important as well. But there is research says it and a clinical connection to that. And so I think that's a great question. Thank you for posing it. And PTSD is that trauma that's not been treated from the beginning. So that's part of the long-term symptoms as well. And so, yeah, I hope I answered the question and hope that was helpful.
Yeah, thank you, Jennifer. And hard to believe we've wound down most of our time here together today. This has been really enlightening and helpful in thinking about how we can be better to ourselves as we're trying to go through the process of quitting tobacco products. I actually have a poll here to kind of close us out, and I'm wondering as I put it up and sort of let it run, maybe David, you could run through some of the key takeaways people may want to think about going forward and offer some
Sure.
ideas there.
Absolutely. And thank you, Todd, and thank you to the X community and the Truth Initiative for having this discussion today. I hope we want some folks to take away a couple of things here from today's discussion. Right. And so we are saying is we recommend treating your trauma and tobacco or vaping, smoking addiction at the same time, as addressing both issues together often leads to better outcomes. Right. When faced with trauma triggers or emotional distress, you can combine grounding techniques like the one we used earlier and nicotine replacement therapy to support your quit journey and your trauma recovery. We want you to use NRT correctly and consistently to get the best results, right? That means you might speak to your medical provider, or there's also some great videos that CDC has on how to use NRT appropriately so that you get the best results from use of that medication. We want you to discuss your plans to address your smoking and vaping with a provider and or behavioral health practitioner. They can help you to understand how nicotine and vape or vaping addiction fits into your overall treatment plan for both trauma and tobacco addiction. And as we've been noting throughout today's conversation, provide yourself with love and grace and engage in self-care by prioritizing activities. We talked about it before, right? We heard journaling, we heard taking a walk, right? Um, Watching little court stuff on YouTube, right? Nourish your body and mind, use exercise, hobbies, relaxation techniques, call a good friend, right? Find that support. Think about things or do things that bring you joy and love, right? Those are the things that also would really help as you address your trauma and your tobacco or smoking or vaping addiction.
David, thank you for those. That's great. And the love and grace I feel is from getting to spend a little bit of time with the both of you on today's session. The poll, we've had a few people go in. I'm just going to go ahead and end things. We've been running it for about 2 minutes here. I know we're running a little low on time. Forgive me for those of you that didn't get to respond yet, but just sort of sharing some of the results here. Jennifer, David, are you seeing my screen with the results? There we go.
Yes. So great to see a lot of folks are using NRT. A lot of folks are going through counseling, joining the X program, right? Using grounding techniques. It's good to see and talking to the healthcare provider. So thank you all for sharing. And I'd like to encourage, use that NRT. I got to be the Tobacco Health Initiative guy to really say that NRT works. We use it correctly, use it often, and it's part of our toolbox to help address that addiction. So thank you all for sharing.
That's great. That's great. Well, so thank you everyone for your time in spending the hour with Jennifer and David and myself. Again, I would encourage you if you found us out on the internet and or responded to this, or if you heard about it through one of our email messages, and you have not joined the X program, it is a free program to join, or you may have an ability to join it through your employer or organization, healthcare organization. So please inquire if that's an option for you. But it is a free program to join. And you can just get there by going to becomeanx.org and start to talk about your journey with others who've been through what you're going through right now. And hopefully you can find support, solace, even some fun there. It is actually a very fun community to be in. And in the meantime, David, Jennifer, so grateful for you both today to spend some time with those who were able to join us live. And of course, those of you who joined us on the replay, thank you for tuning in. Please remember to hit like and share or add your comments to this, and we'll be watching for those as well. I think with that, we will go ahead and conclude today's webinar. Thank you again, everyone who participated, and we will see you again for the next Quitting and Identity webinar series. Look for an announcement soon in the X community and in your emails. Everyone, have a wonderful rest of the day. Take care.